So I verified the provider orders in the chart. I gathered my materials. I have a 14 French catheter. It's fully intact. And then I have my sterile gloves with me. So I'm gonna go in the room, knock, knock. I'm gonna provide privacy. Hi, my name's Michaela. I'll be your nurse today. Today we're gonna insert a Foley catheter. It's gonna go in your urethra and drain your bladder of urine. Can you please tell me your name and date of birth? Perfect. That, I'm gonna raise your head a bed here. And then the sterile field is going to be above my hips at all times. This is a sterile procedure, but I'm just gonna have you lay here. And then I'm gonna lay your head flat. And before I do the actual procedure, I'm going to clean the perineal area for her with soap and water to make sure that it's all clean before the sterile procedure. And then that would be with gloves on. And then I'm going to do hand hygiene. Okay. I'm gonna take your covers down now. We're gonna start. Okay. Like raise your gown. Open her legs. So, take this out. I'm not going to reach across the sterile field once it's open though. Then I'm going to open it away from me first. Inside, side. And then the 1-inch border is not sterile, so I can touch that. I'm going to do my gloves. And I can fix my gloves when they get on. There we go. So now I have sterile gloves. I'm going to keep them above my waist at all time and not touch anything. Take the drape. Then, that was also sterile. So I'm going to take this and attach to the balloon. And then I'm going to put my lubricant in there, and then I would also dump out my iodine swabs. And I would take and put that in there. I'm gonna actually move this over here. Make it a little bit easier. That goes in the lubricant. And then since it's all set up now in the sterile field, I'm going to take my iodine swabs, and for a female, you swab the labia farthest away from you, throw it away, swab the labia closest to you, throw it away, then swab the middle of the labia. And then for a male, you would grasp the penis and do 3 swabs from the bottom to the top. And then once she's all clean, I'm gonna take my non-dominant hand, I'm gonna open up the labia. Now that hand is not sterile, so I can only touch with this hand. Okay, we're gonna insert the catheter. Then I would insert it as far until I get urine return, and then once I get urine return, I will advance it about 1 to 2 more inches, and then once I'm there, I'm gonna hold it with my non-dominant hand. I'm gonna fill up the balloon, and then once that's done, I'm gonna detach the balloon right away, and then I'm going to pull the catheter forward and make sure that it's in place. Then I'm going to secure the catheter to the inner thigh with a stat lock, and then I'm gonna take the Foley catheter bag and I'm gonna put it on the edge of the bed, but not on a movable part. Not on a movable part. Then I'm gonna discard all of my supplies, and if it were a male, you would return the foreskin to where it was. And then I'm going to clean her up. I don't want to tear it. Then raise the head of the bed. Ask her if she needs anything. I'm going to educate the patient that they shouldn't feel the urge to urinate because the catheter is taking away the urine, but if she feels any discomfort, to let us know. I'm gonna lower the head of the bed as much as I can, not the head of the bed, lower the bed, and then I'm gonna give the patient their call light, ask them if they need anything, and then I'm going to leave the room and do hand hygiene, and then I'm going to document the date and time of the procedure, the reason for insertion inside the catheter, the amount and color of urine returning, and the amount of solution inserted to the balloon, and how the patient tolerated it. Yeah, thank you.